Good morning. What a pleasure to see you all bright and early on day 2. It's an absolute joy for me to be up here today introducing this wonderful panel on healthcare disruption. I'm Dr. Bill Bithany. I'm the Chief Physician Executive for the BDO Center for Healthcare Excellence and Innovation. And the innovation part is what these fine folks are going to discuss today. I must say, I was not only pleased, I was really thrilled when Margaret Wong, who's directed this course so beautifully, asked me to be the moderator on this section on disruption and innovation in healthcare. But then she told me I could only talk for 3 minutes. And I said, Margaret, I want to talk about healthcare apps and the latest disruptive medical devices and telemedicine and smartphone apps. And she wrote back to me, tremendous, Dr. Bithany, please do it. But less than 3 minutes. And then I said, but Margaret, smartphone-enabled devices, the internet. I made a long list, telemedicine. And she said, fabulous, do it all, wonderful email. But less than 3 minutes, and then the word Max underlined. So I realized that I wasn't going to have my way with Margaret Wong, that's for sure. She's running this course beautifully, and I'm very proud to be here. So she told me I could tell a little story about my experience with disruptive innovation, and that's what I'll do in the remaining 1 minute and 50 seconds that Margaret has allotted. In 1999, I was the physician-in-chief, chief medical officer for a pediatric hospital in the Northeast. And we decided to launch an open-heart surgery program for poor and destitute children around the world. We started to fly children in from multiple countries, beginning in Panama. But unfortunately, what we found was that time after time, the diagnosis of the congenital heart problem that we thought we were going to face was incorrect. So one of the first couple of kids that we saw, we flew in from Panama. We thought he had an easily repairable ventricular septal defect. However, when he got here, to New York, when he got to New York, we found that he had an irreparable cardiac defect and was doomed to die. And flying him there was not really the greatest thing in the world for the family or for us. And this happened about 40% of the time. So we decided that we would launch a telemedicine program. And since we had some relations in Panama, we decided to start in Panama. Well, in order to have a telemedicine program in 1999, we had to get $4 million of satellite time from Intelsat. We also had to go to the president of Panama personally and ask that we install the first 4 T1 lines in the country of Panama. Nobody could approve it but the president of Panama. So we got British Telecom to put in 4 T1 lines, one for each quadrant of the cathode ray tube that we were using to display the echocardiograms. Well, that cost about $1 million. Well, we started to see patients, the diagnoses were correct. So then we went to Bolivia. And again, to get T1 lines, we had to pay about $1 million and go personally to the president of Bolivia. It was just amazing effort. So we spent millions of dollars to do this work, to get accurate diagnoses. Well, I won't belabor the point, but the program called Medical Missions for Children is a charity. We've treated over 80,000 children around the world in poor countries. We're in over 110 countries exactly. It's grown beautifully. But I can tell you, I didn't bring my smartphone because I was afraid that it would ring when I was up here. But I can tell you everything that we did, almost everything, can be done with my iPhone 6 now at the simple cost of physician volunteer time. So that's quite the disruption from costing millions of dollars to $600 plus some volunteer time. So I thought that was an interesting story, and Margaret said that I could tell it. Thank you, Margaret. I'm going to begin by introducing Dr. Vijay Gurbuxani, the founding director of the Center for Digital Transformation and the Taco Bell Professor of Business and Computer Science here at the School of Business. His research and teaching interests are at the intersection of business strategy and information technology. And what I found in talking to him is that his insights are tremendous and can even be transcendent. It's quite the word.
Thank you, Bill. I don't think I've ever been introduced as somebody who's capable of transcendent insight, so I do not intend to live up to that. Thank you, Bill. That was very generous and very kind. And welcome to all of you to the 25th conference. I mean, first of all, I want to salute my colleague, Paul, because I've known Paul for a long, long time, and if you can pull off, we do our own conference in March, and doing this 25 years in a row, I think I want to give a round of applause to Paul. And of course, Margaret, who's actually, like you said, Bill, what makes Paul look really good. But anyway, more seriously, we are facing a digital tsunami. Digital technologies are appreciating at an incredible rate. And they're changing sort of our business environment in very, very fundamental ways. I just want you to think about your own lives. You mentioned your smartphone and how you could do pretty much everything you want to do with your smartphone. Today, you can take your EKG on your smartphone. You can download movies. You look at my smartwatch, and I have any number of applications. My wife is very gracious to give it to me, even though she complains incessantly about how much time I spend on the smartphone. And think about simple things like Netflix, which is completely disrupting the television and cable industries. And if you do not adapt to the business environment, stronger, more successful, just like in Darwin's evolution theory, the competitors that are adapted to the environment are the ones that will succeed. In the case of sort of humans and other natural species, adaptation is through evolution. In the case of businesses, this is intentional adaptation. And those of us that actually do adapt will succeed, and those of us that don't adapt will fail. And for those of you who think that healthcare is somewhat immune, as it is shown to be over the last so many years, we're one of the slowest moving industries, and I'm very proud to belong to the other industry that's extraordinarily slow moving, perhaps slower moving than healthcare education, are ripe for disruption. And if, your choices are pretty simple, ride the wave or wipe out. So let me sort of talk about my perspective on disruption, and I'm going to focus on big data, which is my charge today. But I want to begin with a quote from Marc Andreessen, and most of you probably know him, who's this extraordinarily successful venture capitalist and who wrote the first internet browser at the University of Illinois, is an investor in Facebook, LinkedIn, and a whole bunch of other places. And he has this claim that software is eating the world. And I want you to think about that because it's a catchy phrase, but what it really means is that software companies are coming after you industry after industry after industry. I want you to think about some simple examples. Skype is a software company that is destroying telecom companies the way we know them. When I came to the US, I was spending $200 a month calling my mom in India. 30 years later, I now call for free on FaceTime. Video call, I'll have you know, right? And so we have wiped out the revenues for an industry. I already mentioned Netflix. You look at what Amazon is doing to Target and Walmart. Amazon is a software company. It's the only company that I know that has a job title called Chief Algorithmic Officer. I want to ask you this question. How many of you have a Chief Algorithmic Officer in your company? Not one hand went up. So let me tell you, you're next. And it's going to happen in very, very profound ways. If you look at what is going on in Silicon Valley right now, they are targeting healthcare in ways that you would not imagine. There are clinical trial companies trying to speed up and design sort of clever clinical trials. They are going after, look at UC has launched this amazing institute called the Computational Health Sciences Institute run out of UC San Francisco. They have more data on clinical health than most pharmaceutical companies. If you run a clinical trial, you have data on a few hundred patients. And when the trial's over, you pretty much lose control. If you look at the electronic health records of today, and you aggregate them over, say, the University of California hospital system, all of a sudden you've got tens of thousands, if not hundreds of thousands of records. This is what we're beginning to call big data. software is where the action is at, because software is what analyzes big data. So let's talk about Verily, and I hope you know what Verily is, because Verily is Google's new name for its healthcare division. I'm sure there's somebody probably referred to this. And this is very, very interesting because Google is a search engine. We all know Google for search. And they were organized as Google, and they had this thing called the division, Project X, or the X division, where they basically went after these super ambitious projects. Project Loon, which will bring internet to the world. I call it Project Loony personally, because it's these helium-filled balloons that will actually give internet access to. They're building a self-driving car, right? They're doing incredible sorts of things. But they approach this in a very, very fundamental way. And none of our organizations have the resources to ask a question like this: how can we use technology to create a true picture of human health? That's what we should be asking, because our understanding of the health system is really kind of in very, very early stages. Even if you look at genomics, we're not doing a great job. And if you start looking at how individuals behave, we are a long way off from getting a true understanding of sort of how our genetic structure interacts with our behaviors, interacts with pharmaceuticals, to generate the outcomes. And we certainly don't understand, believe it or not, the efficacy of a lot of the health procedures and equipment that we use. So these are very, very broad questions. So of course they reorganized as Verily, and this is one of the first divisions that they've launched. They've also launched their automotive division. They have a CEO of this division. They stole the director of the National Institute of Mental Health. Google is very serious about what it is doing in healthcare. They are putting millions of dollars in resources that most companies actually don't have. So let me just quickly walk you through just a few of these examples, but I'm not going to walk you through all. So they're partnering with Novartis on a smart lens for diagnosing or measuring glucose in your blood through the tears in your eyes. They're also building a lens that will adapt, so as we get older and we can't see close by, this lens will adjust automatically. They're working with Dexcom on, again, diabetes monitoring. They're building a robot for surgery with Johnson & Johnson. And then they've got this amazing project called the Baseline Study, where they're really trying to create a fundamental understanding of human health. And these are just 4 examples, and there's more that we probably don't know about. So if you think about this, this is pharmaceutical companies, this is device companies, this is robotics, and this is fundamental sort of science. This is Google's one company's attempt to go after big data. A lot of people wonder about, so I should actually call this Alphabet, but I couldn't find too many slides that said Alphabet, so I'll stay with Google. But Google, if you start thinking about their strategy, all of you, I suspect, operate as sort of the company that the industry, as a company in the industry that you're in. So you are a hospital, or you're a physician practice, or you're an insurance company, or you're a payer, or whatever the case might be. Google has a very interesting approach. They're a software company. They think inside out. They take the core competency view of the world, and they basically say, we are good at machine learning. They're actually far more focused than being a software company. What explains all of their different initiatives is their skill at machine learning. And it's have tool, will travel. And they're going after the industries where they see a lot of profit opportunity. And healthcare is certainly a big opportunity for them. Google, I talk to my buddies in computer science. A lot of computer scientists are part of my research center as well. And the one thing they tell me that Google is easily the leader in machine learning today. They are very, very sophisticated. They're very good at what they do. And most of us don't even come close to understanding our data as well as Google will be able to. So it's a fascinating story and something that we need to pay attention to. Let me switch to IBM Watson next. So you probably saw. So first of all, you can read, they're going after the pharmaceutical industry with Discovery Advisor. If you're an oncologist, you probably already know about what IBM Watson is doing in oncology space. Clinical trial matching, finding you the right patients. Curium, which is a company that they bought on sort of population issues. Yesterday, they announced the purchase of a company called Truven for $2.6 billion. And before that, they bought Merge and a bunch of other companies. So if you look at this, they have bought 4 companies in the last year or so spending billions of dollars. So IBM Watson, by the way, Health, doubled its size yesterday. They went from 2,000 employees to 4,000 employees by buying Truven. So Truven is a company that actually has data and analytics on hospitals' use, and a lot of other things, but let me just focus on one. Hospitals' use of sort of equipment, pharmaceuticals, drugs, and so on. And here's IBM's claim. Number one, Watson as a cognitive computing system needs data to be trained on. So you've all probably heard about Watson beating Ken Jennings at Jeopardy, right? But what Watson did then was study the entire corpus of knowledge around the kinds of questions that Jeopardy actually asked. And it's called training. You train yourself on the data that you provide to it, right? So the big challenge these days for Google, for IBM, is where's the data going to come from that we can train our systems on? And so IBM, with the resources that it has, and IBM is making a huge bet on Watson, is buying companies with data. And here's the claim that they made, and I think this is really important for all of you to pay attention to. This is a company that does analytics, and if you read the quotes from the IBM executives, what they are saying is, we can do much better than Truven on the data that Truven already owns. So I want you to think about this. You have data in your own organizations. No doubt you are doing analytics on the data that you have in your organizations. And what IBM is saying, and I agree, is that they will analyze your data with their technologies, with their machine learning and cognitive computing technologies better than you can. This is something we need to pay attention to because this is a game of efficiency. And they will drive efficiency for the organizations that work with them. Now, I'm not saying this is going to happen tomorrow. I want to be very cautious here because if you talk to the people who work with Watson, it holds great promise, but you have to work really hard at your end, too, to make it work for you. It's not a sort of a package solution that you put into your organization and voila, tomorrow you're going to get fantastic results. That's not going to happen. It takes a lot of work, and there's companies that are already beginning to partner with them. And if they get it right, they will outperform their competition. Payers. I suspect there are a lot of payers in the room. Take notice, because this is coming after you, too. Look at Oscar in New York. It's a very, very clever company, completely app-driven, consumer-friendly, based in New York. They've just come to California. They go after millennials. Now, millennials, as we all know, buy services and buy things very differently from the rest of us. Everything has to be easy to consume, be Uber-like, for lack of a better word, on their smartphone. Now, millennials are a great, great health population to go after. Number one, they demand the least health care. They love mobile. And the first thing they tell them is you can have unlimited telemedicine visits without question. So they are driving their population to telemedicine, which works for that population. But if you look at their technology platform and the analytics that they are doing to get an idea of what your premium should be, they are outperforming almost everybody. This is a company to watch, and this is another big data and analytics play. So the challenge for all of us is that we need to adapt, and if you don't adapt, you're going to die, quite bluntly. Take a look at Target. It was only a few years ago, probably 5 to 7 years ago, when we loved Target. We called them Target because we wanted to give them snobmobile. But we shopped at Target, and we bought stuff that Michael Graves, the late, great Michael Graves, designed. We bought house sort of wares from Mizoni. So they had great product. And they had pretty darn good supply chain and category management processes, as did Walmart. And then along came Amazon. And Amazon does better than anybody else in the world right now at retail. They are so far ahead of their competition, it is scary. And the next thing you know, Target announces 2,000 layoffs, refused to hire the open job positions, combined the positions, and spending $2 billion on digital to catch up to Amazon. And this is an efficiency play. Using the data that Target has, they now have to make sure that they can be as efficient as Amazon. In our house, the joke is, 2 years ago, we didn't even know who our USPS, the postman was, and we didn't know who the UPS driver was. Today, we're on a first-name basis with both of them because they're always at our, literally every day, we get a delivery. But that's the power of big data and analytics. That's the power we ought to be thinking about. And when you think about your own organizations, none of us are using data at the sophistication of an Amazon, the sophistication of a Google, the sophistication of an IBM. And we need to be thinking really hard because, like I said, there is not one industry that this is not happening to. So what do we need to adapt to? One is super fast computing. We've gone from the IBM 360 to the Google service. And I'm going to use a technical term on you for a second. The cost to serve, the cost to deliver computing services has plummeted. And if you look at for those of you who are from traditional industries, traditional companies, I guarantee you that your infrastructure is not ready for prime time, and it costs way more to service your applications than a Google is able to do. So Netflix runs its entire infrastructure on the Amazon cloud, and Amazon is the leader in that space. So we are not even ready from a technology perspective, leave aside sort of the business change perspective, which is much, much more difficult. Mobile is changing the game. We talk about it being a supercomputer in your pocket. It's much more than a supercomputer. It knows where you are, it talks to you, you talk to it, it's got sensors. It's amazing. It can detect earthquakes now, because if all our phones start vibrating right now, start moving right now because there's an earthquake in this room, they know there's an earthquake, because you cannot have 250 phones do the same vibration unless there's an earthquake. So there's amazing stuff that we can do with mobile phones. We're connected all the time. I'm going to skip that. Here's the part I want you to pay attention to. We're digitized. This is a company called Athos, and they make sensors that go into smart clothing. And they track not just your position in space, but also your all kinds of health sort of measures that it then sort of computes. Now, here's the interesting thing. There's very few, or in fact, probably no electronic health record systems that integrate with sensors right now. And you think about me with my Apple Watch, or others with Fitbit and Jawbone, and whatever the case might be. Think about it. If you were one of these vendors and over time, if your systems did not capture the data that we are all generating, this is the source of big data, by the way. We are all data generators. Every single thing that we do leaves a data exhaust, and you need to think about that. And your smartphones are, by the way, generating more data. So when I started watching this whole Apple Tim Cook controversy with the government, I'm sitting here saying, we have given away so much data. I mean, Apple knows every second of the day, or in your case, Google, or whoever your smartphone provider is, they know where we are 24/7 because the phone tells them. There's incredible data that they have on us already. So I'm not going to talk about where the sources are, but everything generates data, and very little of this data is actually being analyzed. What's different about big data? A lot of people think big just means big. So it's a lot of data, which is part of the picture, but there's also a lot of different kinds of data. So imaging data, textual data, things that we do on various platforms. So it doesn't all have to be data that goes into tables, which is what computers are good at doing. We need to focus, not get lost on big data. We need to think about the answers we are trying to generate. It's the questions that we ask of the data that give us value, not the data itself. And learning how to ask smart questions is very, very important. I heard a presentation by Atul Butte, who's the director of the University of California Institute, and it's fascinating. He is building companies, asking questions of public data that nobody has asked before, coming up with these wonderful insights, building companies around his insights, and selling them. And the beauty of the thing is he hasn't done a piece of research in his own companies, even though he's a phenomenal researcher. Quick couple of examples. If you're in Canada, they're monitoring your diet. So this is examples of how big data can be used. So if you look at point-of-sale data at stores and supermarkets and 7-Elevens, and you see what's being sold where, you can actually predict obesity, looking at store-level data. This is what big data allows. So most of science has been about getting microscopic, right? So we go lower into, once we have figured out how the microscope, we could go to sort of cell level, we could see abnormalities, and then you go to the nano level, and you go deeper and deeper and deeper, and you understand, you go from atomic to subatomic to particle to subparticle, and now I'm out of my depth. The difference in big data is actually you're starting top-down. You're seeing patterns from the top rather than going. It's a very different way of getting insights from the data that you have. It's about aggregation of data. It's about taking the data we have in varieties of systems, putting them together. Then we've got community platforms like Patients Like Me. So this started off as a support group, basically. If you got a particular kind of cancer, you get into the system, you see how people are doing with it, you support each other, you figure out who's got what side effect. The business model didn't really work for them initially, and so guess what they're doing now? They're selling their data to pharmaceutical companies. They've got partnerships with Roche and a bunch of other big companies. Fascinating, fascinating story. Exactly the same story with 23andMe. We were supposed to all buy our own, sort of genetic information for $100 or $200 or whatever the price was. And then the FDA told them that you can't say all of these things, and so they became a consumer toy. But they're taking their data and selling it to pharmaceutical companies. So if you are a pharmaceutical company, think about the data that you now have available for research that you never had before. So this is just incredible things that incredible set of things that we're allowed to do. So when you analyze, you have to think about. So there's lots of different kinds. There's descriptive analytics, what happened, diagnostic, why, predictive, what will happen, and prescriptive, what should I do? And these are the sort of classes of questions that you need to ask of any data set that you have. And you may be at a different point in time. So, we don't understand a lot of things about human health. We want to know, like one of the biggest sort of opportunities in pharmaceuticals right now is building drugs or identifying the population for which certain drugs work. So some of these drugs that they sell for $200,000 a year or $200,000 a patient, they work only in 40, 50, 60% of the population. Because if you don't have the right genetic sort of sequence, it doesn't work for you. And they don't really understand that very well. So think about how much money is being wasted because we're sending these drugs, applying these drugs to the wrong populations. If you think this is sort of difficult to do, the example you need to look at is GE. GE is becoming a software company. They call themselves the world's premier digital industrial company. They emphasize it is digital and industrial simultaneously. That's what you have to do. So they want to be the world's top 10 software company. They have the best analytic platform. They have the best analytics platform there is today. It's called Predix. They have a huge data platform which integrates all of the data from the thousands and thousands of sensors they have in every one of the machines, from aircraft engines to locomotives to MRI machines, and they analyze it. But then there's a custom module that sits on top of each of those that works in the particular vertical that it's in. This is the company to watch, and if they can pull it off, this is a company that was founded by Thomas Edison in 1892. They were part of the second industrial revolution in electricity, and they are still the innovators today. They're the only company that was on the first Dow Jones Index that is still on the Dow Jones Index. It is an amazing story of reinvention, and we need to sort of emulate GE. A lot of what we compete with is the know-how that we have. The know-how that goes into a drug, the know-how that allows a doctor to prescribe medications, the know-how that allows a doctor to sort of diagnose, the know-how that allows an insurance company to sort of price, to develop its premiums. That know-how needs to be codified in software using the data that we have so we can optimize. Every company needs to think about acquiring software as a core competence. When the foundation of the world is a digital platform, we all need to think about how we can compete in a software-driven world. I'm going to conclude by saying we are all software companies. Some companies just don't know it yet. I want to close with for those of you who are further interested in this topic, we're hosting a conference on March 24th right here, so please join us if you can. And with that, thank you for your attention.
Thank you so much.